Hello guys, this afternoon we'd like to do a procedure we call pressure area care. So pressure area care is a procedure which we do to patients who are confined to bed. For example, those patients who are unconscious, they cannot move or even turn or even just to see, okay, this part is painful or it's becoming injured and try to move or relieve pressure. So they rely on the nurses to do that, meaning that the nurses should be able to turn these patients 2 hourly to prevent pressure sores. And even after that, you can also do pressure area care, meaning you're going to clean up the area just to wash with soap and apply Vaseline so that sores are not formed. Those sores can be called decubitus or pressure sores or bed sores. So you can use a name similar to that, at least something closer if you have forgotten those names. Okay, so these sores, when formed, they form wounds which are not even pleasant to look at. So it's up to us, the nurses, to try and prevent pressure sores. So we do a procedure called pressure area care. Okay, so for us to do pressure area care, okay, we're going to have soap, okay, then we're going to have flannels, and we can have cotton wool for the eyes so that we clean the eyes and freshen up or refresh the face. Okay, then we have hot water, cold water, then we have a basin. This is where we're going to mix hot water and cold water. Then we have gloves. These gloves, we are going to don the gloves with me and my assistant. We're going to don the gloves. Then we have also a Vaseline, which we're going to apply on the pressure points. Then we have towel, which we're going to use to protect the linen from getting wet. And then that receiver to receive any, maybe say anything dirty that you're going to throw, anything from the bed. Okay, you're going to use the receiver. So this is not a bed bath. You're going to differentiate. There's a difference between bed bath and pressure area care. Bed bath, you bath the patient in bed. Pressure area care, just focus on the pressure points. Do not bath the patient. It's only on the pressure points. That's your focus. Okay, so let's begin so that you see how this procedure is done. Okay. So you do the hand washing. That. Okay. So you're going to do it in 5 minutes. Okay, which is very short. Okay. So, good morning, Mr. Mambwe. I am student number 2 from Kalulushi College of Nursing. I have been assigned to do pressure area care. May I please go ahead? Okay, you can go ahead. So, is there anything you can do within your reach for now? Said nothing. Okay, what about where you're sleeping? How is it? Okay, it's fine. So there is nothing worrisome there. Okay. Stanislas, would you please be my assistant?
Okay.
Okay, so Stanislas is going to be my assistant. So he has already washed his hands. Then he's going to don gloves. Okay. Then even me, I will be able to don gloves. So that's how we do it. Okay. Like that. Okay. So once you do that, now you can mix the water. Okay. So there is hot water and cold water. So the question is, which one do you start with? You start with cold water, not hot water. Okay. So you put this cold, then you start mixing with hot water. So when you do that, you use your elbow to feel. Okay, so you try again, you mix so that you don't bend the patient. Okay, so this is okay for the patient. Okay, you use your elbow. So at this moment in time, what you do is you start with the face. Need to refresh. Okay, the patient should be, refreshed. So you start with the face. So you can either use cotton or you can just simply use a flannel. So let's see if we use a flannel. Okay. So I'm not using soap on the face, just to refresh, just water. Okay, so there you can also put a towel under. So my assistant helped me lift the head. Okay, there you go. Okay, so just freshening up, you can use figure of 8. What I mean by figure of 8, you're going to draw 8 on the face. So you can start from here, okay, here, then you go this way, okay, then and that's below the nose, then there, then this side of the chin. So you started from here, there below the nose, then you go there. Okay, so even this side you can start from there, on top of the nose, okay, and below. Okay, that's what you do. So if the eyes have got any discharge, you can simply wipe from, you can start from inner canthus to outer canthus, inner to outer. So you can just simply wipe one, then you discard, you get another one. You can do that. Then you can also do this. So you can start with the furthest, then you go to the nearest. Okay, so that's a figure of 8, meaning that the patient will feel refreshed, the eyes are cleaned, and then also do a figure of 8 like I did, like this. From there you go down and go this way, and also this side you go that way, then this way, meaning at least the face is refreshed. Then the next point we're going to go to is the chest. You have to go to the breasts. So now there is this extra linen. So this extra linen, my assistant, we're just going to do this, or one by one if you want. That, then you remove it. We have seen that the linen is heavy, so you can remove it. Okay. Okay. So like that. Then you can go to the breasts. So there you can apply soap, okay, and then just on top of the breasts like that. So you go like that. Some will use long strokes because you want to promote blood circulation, so you can use long strokes, okay, to promote blood circulation. So you can just simply do that, okay, and even below the breasts, okay, you can lift up and do that. Then you can get something dry and just pat, okay, and then after that you can apply Vaseline, okay, even below there you can apply Vaseline. So you apply Vaseline up there and below, okay. So after you do that, now you can be able to turn the patient in lateral position, okay. So let's turn the patient in lateral position. So how it goes, that arm goes that way, then this other limb goes on top of the other like this, okay, so that we turn the patient that way. So my assistant, let's turn, okay. So the patient has gone that way, okay. We're not exposing the patient that much, as you can see. So what you're going to do is now you're going to focus on the pressure points only. So get this, okay, and apply soap, then go. The pressure points in this case, as you can see, there is this here, there is this bone, the scapula. So this can form a pressure sore, okay. So I'm going to go just there. Do not massage because you're going to damage the skin. So just simply do that, okay. That's the scapula, meaning the scapula is done, not everywhere, just the scapula. And then also this other scapula, okay. Then you can also go in the along the vertebral column like this. You can also do maybe a long stroke if you want, or you can do circular, so that at least there should be blood flow. So you've done the scapula and the vertebral column. You are not doing this part because you're not batting, just focusing here, there, and then there, okay. Then since it's OSCE, you're running out of time. Let's go straight, okay. This is the crests, so you can go to the crests, okay. So the crests, once they're done, and also the sacrum like that, and this other crest, okay. Then you can also go to the head of femur here, okay, and do that. So you can rinse this, okay, and then apply soap, okay. After you apply soap, again you can come. So since you've done the head of femur this side, you can also go here. Okay. So on the knee, you can try and do that because you know this can form a sore. Okay. Then even this side, you can do the knee. Okay. Then when you come here, you can do the calcaneus and the malleolus, like that. This is lateral malleolus, then medial malleolus, you can do that, and the calcaneus, you can do that. At least these can form pressure sores. Even you do the same to this other side. Okay. So once you do that, you can, if there is excess water, you can pat. Not scrubbing, but just patting. You can pat the pressure points. Just, you have to be fast so that at least you have time to do the rest of the care. Then you can also apply now Vaseline in the pressure points only. So the scapula, again the scapula, then the vertebral column. Okay, you can apply Vaseline there. Then the iliac crests. Okay, even this side you apply the head of femur there. But mind you, the other side of the femur, we haven't yet done this other side, but we've done this side. So that side will be done as well. So now, on the patella, okay, even this side, patella and inside, then you come again, you apply on the calcaneus and the malleolus, okay, you can do that. Even this side, if the toes maybe, you can just put a little bit. Then this other side of the limb as well. Once you apply, what follows? Need now also to turn the patient just to do the arm there. So look at this side, the pressure points here. Once also you have scrubbed, like the elbow, okay, and also maybe here, the wrist, okay, and mostly the elbow and then just part of the shoulder here. You can dry or pat, okay, then apply. Okay, you can apply there, you can also apply here. So the other side is not yet done. So we can turn the patient. Let's turn the patient back. Okay. So the part which is not done in that position where the patient was the hip this side and the arm. So my assistant can try and do the arm there. Okay, since it's only the arm and the hip, so we can just do that. Okay. So I have to put soap quickly, okay, and give my assistant just do the elbow and the wrist. So just outwards, yeah. So once he has done that, I have to give him soap. Okay. So that soap is helping at least to remove the dirt. Okay. So just simply repeat the step so they see the elbow and the wrist. Okay. Then now let's dry and put Vaseline. Okay. Okay, so let's put Vaseline. Okay, so once that has been done, you can check even this side. How is the femur? So if this is not done, you can also do this part here so that at least the pressure which is here is relieved. You can try to see if it's reddish on the patient, so that you're trying to see if the skin is getting destroyed or damaged. So once you have done that, meaning that you have cared for the pressure points. So thank you very much, my assistant, for helping me. Okay, and my patient, thank you very much for allowing me to do this procedure. I was doing this procedure so that we prevent bed sores. Okay, so we'll be coming again to tenure. Okay, we'll be coming to tenure so that we don't develop sores, and also we'll be coming to do pressure area care. So at this moment now, you can even make a bed as quickly as possible. Okay, you can get new set of linen if you like. Okay. do that. Just you won't have to be quick. So then you can even go to the examiner and report to say that you have done pressure area care and you have left the patient comfortable. Okay? The patient has been left comfortable and pressure area care has been done. So you have to just keep up with the speed so that you manage to do the procedure within 5 minutes. So thank you very much. You can remove the gloves inside out. Then you also go and wash hands. Okay. Okay. So that's what you are going to be doing so that you prevent pressure sores on the wards. But take your time. If on the wards it's not 5 minutes, you can do it with your time that you have, maybe 30 minutes or 20 minutes. But since we are doing it on a dummy, it's 5 minutes. Have to be at your best speed. So thank you very much. Keep practicing.